My name's Sydney O'Shaughnessy, and I chose to focus on Monaco's healthcare system in comparison to the US's healthcare system. Before I get started talking about healthcare and their environment and safety, I first would like to point out where Monaco is on a map because prior to me visiting there, I had no idea. So over here we have Monaco in relation to Europe and some of the other countries. It is represented by that tiny red square over there. And then this one we have it in relation to France. So it lies on the southern border of France and opens up into the Mediterranean Sea. And then if Italy was on the map, Italy would be over here, branching off. And then when I say that Monaco is represented by that tiny square, it's really tiny. So it is actually the most densely populated country. It has 30,600 people living in 2 square kilometers, and it is the second smallest city behind the Vatican City. So the type of healthcare system, they have a social insurance system. It covers employees, families, and the disabled. It's funded through employee contributions. There is a set percentage that is applied to how much an employer makes, and that is how much they have to contribute. Medical services that are covered by the public health insurance is hospitalizations, primary care, specialty care, medications, lab services, transportation, and prosthesis. In regards to the specialty care, like dental care, I know they only cover like routine checkups and that kind of stuff. So there is an option to purchase private insurance. So some people do purchase a supplemental insurance just for some of the specialty care that is not covered. Monaco has 3 main hospitals. So they have their Princess Grace Hospital, which is their largest, and it is the one that you would go to if you needed to go to the ER. They have their Cardiothoracic Center of Monaco, which is designated to cardio and thoracic diseases and illnesses. And then they have their hemodialysis, which specializes in kidney-related illnesses. And then their population health. So I chose to focus on life expectancy at birth because it was pretty crazy. So the average life expectancy at birth is 89.4 years. And to compare that to the US's is 80. So it's about 9 to 9.5 years longer in Monaco than it is in the US. The female's life expectancy at birth is 93.5 years and males is 85.99. And Monaco is ranked number 1 as of 2017 as having the highest life expectancy at birth. So for healthcare spending, the total healthcare spending per capita is 7,302. It spends 4.2% of the GDP on healthcare. And to compare that to the world, it's ranked 160. So it is kind of low on the countries. The lower you are, or the lower the percentage, the lower you are in general. And then their immunization rates. This is a graph, and so the colors represent the percentages and how high. So the more green you are, the higher you are in the percentage. So the one that we are primarily focused on is the Hep B3, which is your influenza type B vaccination. And it was at 100% in 2016, which is pretty cool, pretty good to be at 100% or close to 100%. The other vaccinations that are listed on here is your Hep B, your polio, rubella, and then your measles vaccines, and all of those were close to, or if not at 100 as well. For health prevention of chronic diseases, Monaco has had a lot of new things come about and focus on prevention. One thing, obviously, they have their preventive health screening center, which offers free anonymous screening for STDs, campaigns for different diseases like cancer. They also do screenings for cancer as well. And then they have their Monaco Red Cross, which is very similar to the American Red Cross. They have blood drives, they do events, they have fundraising, and they hold information and try to promote health and awareness. And then the other thing that I thought was interesting was their cardiothoracic center of Monaco. I thought it was cool that they have their own hospital for cardiovascular related illnesses, because cardiovascular disease is one of the leading causes of death. And I thought it was pretty cool that they had it there in Monaco, and I'm sure that the leading cause of death is also prevalent in Monaco, just as is in the rest of the world. Their physical environment. So when I went to Monaco, I felt relatively safe. I didn't feel like I had to look to see who was around me. I didn't feel like I was ever in a bad neighborhood of Monaco. So I thought that their safety was relatively good. And when I read stuff online about it, they do have a high police presence. They have security cameras everywhere. Their fire and emergency staff has at least 50 men on watch 24 hours a day. And they respond to more than 8,700 calls per year. The fire engines are deployed more than 10,000 times a year, with an average of 24 operations per day. And then this is actually the picture I took of the Monte Carlo casino. Their police presence in there is crazy. They have a lot of police and people monitoring. And then on their government website, they actually have a link that talks about what they do during events and how they increase their police presence during events that bring in a lot of tourists. So for access to care, I chose to focus on the mental health and mentally ill. The total number of outpatient facilities for mental health that they have in Monaco is 2. They have 0 mental health hospitals. And then the psychiatric beds in general hospitals per 100,000 was 57 beds. So there's not many facilities or beds that are available for people that are mentally ill or mentally disabled. One thing I did find that was interesting was they have the Monaco Disease Power, which is a program that started in 2007, and it's there to represent and integrate individuals with disabilities, and it assists young people with disabilities, and it also is a day center for parents who do have children with disabilities. They go out and do activities, they plan events, they have charities, so they do a lot of things to benefit and to help not only the children or the people that are disabled mentally or physically, but also the families as well. The unemployment rate in Monaco is 2%. In comparison to the world, it's 13th, which is pretty good, so fairly low. It's a pretty wealthy country, as you can tell. There's a lot of boats, and houses are pretty cool. They are right next to each other, but they're very nice. There really wasn't much I could complain about Monaco. You can just tell by the environment and everything around them that it is a fairly wealthy country. So in conclusion, after doing all my research, the people of Monaco are pretty healthy. They obviously have their death rates and whatnot, but overall, they're a pretty healthy country. They use prevention as a key factor. They have had a lot of new and upcoming stuff about prevention, and they have the prevention center, and they have a bunch of programs that help people get involved with their health and screenings. Their immunization rates were very high among most vaccines that are there for them. And then their private versus public insurance, it's kind of opposite of the U.S. While we have Medicaid and Medicare that a lot of people are on now, prior to that, private insurance was the large insurance that was used, and it's just kind of cool to see how the public insurance is used mostly in Monaco, and they're a fairly healthy country and they have a lot of stuff going for them. So that is, oh, move these. And then these are just my references, but that is all, and I hope you enjoyed it.